Hi. Hello, everyone. This is Dr. Debbie Hamilton from Research Nutritionals. Today, we are going to interview Dr. Allan Magaziner on integrative cancer care. And Dr. Allan Magaziner is one of the nation's leading authorities on integrative oncology, nutrition, and preventive medicine. Dr. Magaziner established the Magaziner Center for Wellness over 30 years ago and serves as the center's medical director. Dr. Magaziner has pioneered his cancer support program aimed at changing the behavior of cancer cells, mitigating the side effects of chemotherapy and radiation, enhancing the immune response, and improving the outcome and quality of life of patients with cancer. He has spent many years studying innovative cancer breakthroughs from all over the globe and brings his knowledge and experience to his patients in practice. The Comprehensive Cancer Support Program has benefited hundreds of patients who have been diagnosed with cancer. Welcome, Dr. Magaziner. I'm really happy that you're joining us today.
It's a pleasure to be here.
So my first question is usually, how did you get involved in integrative cancer care?
Well, if we back up just a moment, exactly. And I got interested in holistic and integrative medicine in general about 35 years ago, or more than that actually, when I was in medical school. And I saw that the current model of medicine and, pill for every ill was not working for me, not working for my patients either. So anyhow, to make a long story short, I got very interested in functional integrative medicine, and I practiced that, and I still do. But about 20 years ago, as my patients started coming to me, more and more patients who were being diagnosed with cancer, they were coming to me saying, hey, can you do anything for me? And of course, I didn't know that much about it at the time, but I knew that there was information out there that I was dabbling with. And I started going to many, many seminars to the point where I was going to literally 3 to 5 a year just to learn more about integrative cancer therapies. And I found out that there was a whole world out there that I really hadn't learned about yet that much. I heard about the use of, for example, intravenous vitamin C and some other things, but I started putting together a very thorough, comprehensive program, which now I've been using for nearly 20 years, and it's really been a godsend for many of my patients now. So, it's just it was a natural progression and evolution from the fields of integrative functional medicine, personalized medicine, whatever people want to call it, what we do. And it eventually branched out into the field of oncology because it's so prevalent in our society today.
Right. I'm about to say, I think there's a huge need for integrative cancer care. And it's definitely an area that, go ahead.
Mm-hmm. No, I was going to say that, the statistics are really lousy. 1 out of 2 American men will be diagnosed with cancer at some point in their lifetime. It's that high right now. And for women, it's not that much better. It's about 1 out of, it's about 40%. And so between men and women, it's about 45% will be diagnosed with cancer at some point. And the current therapies that are being offered to our patients are really not that effective in most cases. And so I think that people are looking for other options and alternatives, and they're looking for something more than only surgery, chemotherapy, and radiation. And that's where we excel.
Right. And personally, I think you're right. We're all touched by cancer, a family member, but the 1 and 2 statistics are really frightening. That's a pretty high rate of disease. So,
yeah, and we're seeing younger and younger cancers too. By the way, it's not just the number, but the people who we're seeing now are younger than ever before, and some of these cancers are more aggressive than ever before too. So, there's been a significant shift in the last 20 years.
Oh, that's frightening. I wonder if just when you think about environmental factors, but wow, so there's really probably more of a need than there ever has been, really. And I'm a pediatrician, so in my area too. So you talk about a comprehensive cancer support program. So what are the goals of this?
Well, the goals are really to improve the quality of life as much as possible for the patient. That's one thing, because the quality of life isn't. I don't think it's emphasized enough in conventional medical settings. They talk very much about did the tumor shrink or not shrink. They talk about how long the patient's living or not living, but they're really not talking about the quality of care, quality of life that the patient has. So that's first and foremost in some ways. And we always question our patients. We have them fill out a questionnaire about their quality of life. But also we're trying to get our patients, of course, to live much longer, live healthier, and hopefully get them into remission where they can have, long, prosperous, and engaging lives.
Right, and that's great. Well, what are parts of that? I mean, what about diet, things like diet? Like, do you have any specific diet you recommend?
Absolutely. Well, I think the most important thing, and by the way, diet probably accounts to perhaps close to 60% of cancers, 40 to 60% probably, might be induced by what we're eating every day. We make decisions 3 and 4 and 5 times a day, deciding what we want to put in our mouth, and those decisions are crucial. because those decisions can either turn on certain, pro-inflammatory genes, they can turn off pro-inflammatory genes and cancer cells. So the point is that what we desire to eat and the choices we make are absolutely crucial, and we shouldn't take those for granted. As far as, more specifics than that, I really emphasize the importance of eating a whole foods-based diet, first of all, and foods that basically our great-grandparents probably ate in their day. Great-great-grandparents, maybe I should say. The food at that time, of course, wasn't as sprayed. It wasn't genetically modified. It was mostly organic, although they may not have used that term. And they weren't eating all the processed foods. Our diet's probably about 60% today of processed foods and 20% simple sugars. So we're talking about 80% of our intake is junk. It's not food.
Yeah.
It's junk.
Right. It's not food. That's
the first and foremost. No, it's not even food. Exactly. So we have to, eat very colorful foods. I tell my patients, color your plate. Use lots and lots of plants. Use a lot of vegetables, a variety of colors, and they, of course, contain various antioxidants and phytonutrients and high fiber foods. And, then we get into like seeds and nuts and beans and specific fruits, especially the low glycemic index fruits, which are like berries and apples and pears. And of course, not too much alcohol. Stay away from fried foods and trans fats and hydrogenated vegetable oils and, all the things that we probably tell our patients anyhow. But I mean, that needs to be really emphasized with the cancer patients, and especially staying away from the simple sugars, because cancer does thrive in from glucose and glutamine. It's part of the fuel that seems to help cancer cells flourish. So I think that's very important, and I put a lot of emphasis on that. And we take a look at patients' glucose levels, but not only that, their hemoglobin A1C. We want to drive it down towards, if we can, even at 5. And people often can't get that low or aren't interested. But it's very important that we really emphasize the importance of whole foods, unadulterated, as fresh as possible, and not synthetic. I call it synthetic foods.
Synthetic foods, right? Because I don't think the oncologists tell their patients that. One of my good friends, who recently passed from pancreatic cancer, I talked to him about diet. He's like, oh, no, my oncologist said to eat whatever I can. It's like, no.
We hear that all the time. Unfortunately, we hear it all the time.
That's terrible. Yeah.
Exactly. And, in medicine, we know that 8 or so of the 10 leading causes of death are due to, in part, by what we decide to eat every day, whether it's diabetes, hypertension, heart disease, cancer, obesity. Most of those diseases can be triggered or often, somewhat triggered by what we eat. And so my feeling is if you're sick, you have to be even more careful. And unfortunately, oncologists don't even discuss diet with patients because they're so, I call an oncologist typically a chemotherapist. And that's what their main emphasis is on, what chemotherapy to give to the patient. And they rarely discuss health and wellness, and they put 90% of their emphasis on disease and the disease model, which I think we need to change the mindset and start thinking differently. But they put people on Ensure and ice cream, and they tell them, don't worry about what you eat, it's nothing to do with it. But we know that's not true. So, I think every single patient needs to, in fact, meet with not only a good integrative physician, but even like have a health coach on board and be part of a team so we can best be able to improve the quality of life for that patient. And it's not just about chemoradiation because they're fraught with so many side effects too. So we have to work on reducing risk side effects too.
Right. Well, what about that kind of workup do you do when you have a patient come in, like laboratory tests? Well, we obviously know they already have cancer, but what other things do you need to look at?
Well, we have to do a very comprehensive analysis, and a lot of times in my practice, they get 12, 14 tubes of blood drawn the first day that they're here, and maybe more. So, in addition to standard, laboratory work such as a CBC and chemistry profile, which, by the way, that's what a typical oncologist does, or internist, and they don't do much more than that. And they try to assess and they try to guide their treatment just from those 2 tests, and that's simply not enough. And so we delve much deeper into the cellular level, and try to figure out what's going on with that patient's biochemistry and what is unique about that patient, and what might be driving those cancer cells to progress and to unfortunately sometimes metastasize. So. Right. Just to talk about some of the kind of laboratory studies we're doing, we take a thorough look at the immune system, first of all, and that might include looking at T cells, B cells, lymphocytes, cytokines, immunoglobulins. And a traditional oncologist isn't looking at those things at all. And it's a shame, because these are the areas that are so important if you don't have an intact and strong immune system, you can't expect your therapies to work that well. And then on top of that, when they give a patient chemoradiation, those areas are damaged. The immune cells are often so damaged by the conventional therapies that are given today. So that's why a comprehensive support program, number one, is important to support the immune system. On top of that, we do a whole battery of inflammatory analysis. So there's a lot of things that we look at, but so inflammatory cells are really important because inflammation, as we know, can drive so many chronic illnesses today, including cancer, and there's a bunch of others you can say, heart disease and stroke and diabetes and obesity and depression, but we're talking cancer here. So looking at the inflammatory cells so we can guide our patients as to the best anti-inflammatory program possible is vitally important. We also look at different proteins, and one I'll throw out, which a lot of people haven't heard about perhaps, and I think it's vitally important. It's called galectin-3. And galectin-3 is a protein. We all make it, and it's a lignin. It's a very complicated sort of structure, but it's a stimulus for inflammation, and it gives rise to what's called NF-kappa B. And it's when this protein, if it's high, and it's a simple blood test that most labs can do if you ask for it, it drives cancer progression, and it drives metastasis also. And it's also a very good, unfortunately, predictor in some way. I say unfortunately because if it's very high, it can be predictor for survival. And if it's above like 25, studies have shown if it's above 25 for over a year, there's almost like a 99% mortality rate in that patient. Wow. So, unfortunately, oncologists aren't looking at what's happening in the cancer, what's called microenvironment, not looking at the terrain of the patient, and figuring out what they can best do to target these pathways that might be aberrant and abnormal. So, anyhow, the galectin-3 is important. We also look at what's called D-dimer, which is we've all heard of it for possibly for blood clots, in the leg or clotting factors, and also like pulmonary embolism. Doctors look at it for that purpose. But because cancer is what's called a hypercoagulable state, meaning the cancer cells are much more prone to blood clots, and it's one of the leading causes of death, unfortunately, in a cancer patient, we look at that so that if it's high to start with, there's things we can do to target that patient to bring that level down. So the patient, so we can hopefully prevent and reduce risk of a blood clot formation. And by the way, chemo is often something that can cause blood clots of itself. So between chemo and the cancer, those are both conditions that can give rise to clotting, and therefore it's important that we assess this, once again, monitor, and try to give factors and nutrients and such that may reduce the risk factors for this kind of condition. Right. There's a whole bunch of other things we check. We check vitamin D. Of course, we try to optimize vitamin D, not 35 and 38, and you're told you're fine. We want it to be, 60, 70, and 80, because it's all about optimizing, the patient's biochemistry. There's a wide range of other things. We may check heavy metals. We may check chronic infections such as, viruses, bacteria, and funguses, because those things can account for about 16 to 18% of all cancers too, by the way, the infectious etiology. Yeah, and then there's a bunch of things we might look at for mitochondrial function. There's certain blood tests that aren't perfect probably, but they are as good as we have right now in a simple clinical setting. So we do check different factors that might give some assessment of mitochondrial function, because cancer also is a mitochondrial disease, which means the mitochondria doesn't derive the appropriate energy in the cells. So anyhow, so we look at mitochondria, we look at heavy metals, we may look at toxins in general, and also hormones, especially if it's a breast cancer or female cancer type of a case. We certainly will look at hormone metabolism, same with men with prostate cancer. So, it's very important that we do a comprehensive assessment so that we can best give our patient the chances of a long life, quality of life, getting them into remission and giving them a long-term survival. And unfortunately, these are areas I think are greatly lacking in conventional medicine. So, we strive to, and the other thing is we monitor patients ongoing during our treatment plans so that we can see, are we improving these factors that I've just mentioned? In conventional medicine, all they're going to do is a CBC and maybe a chem profile and maybe some tumor markers. But truthfully, by the time you have change in those few things I just mentioned, it's almost too late. So we're here to prevent, we're here to find early biomarkers so that we can protect our patients against, the leading cause of death in a cancer patient, which is not the tumor, by the way. You don't die just because you had a lump or bump on a breast or prostate. You die because of metastasis, because of blood clots, because of sepsis and infections, because of
Yeah.
cancer cachexia, and also because of end organ failure, damage to the liver, kidney, heart, whatever. So if we can protect our patients from those things, we're probably going to give that patient a good quality of life and a longer life as well. So,
yeah. I mean, it seems amazing that you wouldn't address the immune system that comprehensively for somebody who's fighting cancer, and their immune system needs to be active in order to address the cancer. So that's kind of crazy.
It is completely crazy. Go ahead.
Or even the inflammation. I mean, everything you mentioned, everything makes complete sense. That they don't do that for even the diet stuff. It seemed in some ways really kind of common sense.
No.
But now you talk about how cancer cells are different than regular cells, and you started to talk about mitochondria and metabolism. I mean, how are they different?
They're very different. So cancer cells, number one, they found, in fact, Dr. Otto Warburg, who won a Nobel Prize, by the way, around 1931, I believe. He was an MD, PhD in Germany, found that cancer cells are very different. And first of all, they thrive in an anaerobic environment, and they ferment glucose, which is sugar, of course, for their energy. Yeah. So whereas healthy cells, they thrive on oxygen for their energy, and they work in aerobic environments. Yeah. And so cancer cells, so we're part of our goal is to transform the anaerobic glycolysis into an aerobic environment when we're dealing with cancer. And there's different therapies that I've been using that help in that area. Also, cancer cells are what we call in a very low energy state. And, even though, and they're a very hypoxic state. They're of low oxygen content as well.
Yeah.
So to summarize those three things I just said is, they thrive on glucose and they're in an anaerobic glycolysis. They are in a low energy state and they're low oxygen states. So part of the goal for therapy should be to try to reverse those three trends. And that should be a mainstay in any comprehensive cancer program. And unfortunately, once again, I hate to bash conventional medicine because I'm a regular doctor myself, but I branched out a bit. But they don't look at these things. They don't emphasize these things. And if you don't address things at the cellular level and address the mitochondria, which is where the action is and where we make the ATP for our fuel and for the powerhouse, powerhouse of our cells, the cell dies off. And once the cell dies off, you're going to get more oxidative stress, reactive oxygen species, and this is what causes progression of the disease itself. And so we have to reverse this whole system of altered biochemistry and altered metabolism. And so, even with cancer patients, it's not just about treating their genetic mutations. You also have to address their altered and abnormal metabolism and biochemistry.
And how do you do that? How do you kind of address the mitochondrial issues, or just, like I said, the glycolysis?
That's a big part of it. Yeah, so there's a lot of different substances that I use, biologicals and targeted nutrients, both orally as well as intravenously, that can be very efficient sometimes to change the metabolism of these cells, and to also, by the way, change a cancer cell from more of an acute disease to now a chronic disease. And that's part of what we should be doing too, is trying to change cancer to more of a chronic disease, because my belief is you can live for quite a long time with cancer if you look at it differently and don't try to just kill every cancer cell, in acute fashion, because you often will kill the patient too, unfortunately. And there's so many risks and side effects. Yeah, they did a study on that, and they showed that when cancer patients died within their first 30 days of chemotherapy, 50% of the time it wasn't from the disease, it was from the chemotherapy. And this is not unusual. And so you have to protect, that's the thing, we have to protect the healthy cells. And there's a lot of different ways of using the nutrients that we can talk about here. Orally, we do a lot of work with intravenous things. And the other thing I do a lot is with energy medicine. And so there's different machines that we use that have been shown to improve the mitochondrial function through the energetics of the body. In addition to that, I often will use some oxygen therapies, whether it be, for example, hyperbaric oxygen we use, because I already mentioned that cancer is a sort of hypoxic state. And, I do some other alternatives such as ozone therapy, which I know is controversial, but we do use that in our cancer patients. And that also helps to oxygenate our tissue. It improves the what's called antioxidant defense systems of the body, improves immune response. It reduces tissue hypoxia. So, there's a lot of different therapies once you branch out into this world, which I guess I have gone on the dark side here. But seriously,
a lot of different things.
There's so many different things, and they can be so effective. We see our patients are thriving while surviving. They live longer. They feel good. And yeah, that's a term that I coined from one of my other friends that gave it to me. So I can't claim I didn't coin it. She did. But anyhow, you got to steal a little bit of information from people. But no, but seriously, our patients, they come in sometimes so sick because of injury and damage from prior treatments. And also when they've had recurrences, by the way, that's another big problem. When they have recurrences, it means that their cells are probably, their cancer cells, are probably resistant to the conventional therapies that they've received previously. And therefore, they're even more, these cells are now more aggressive, more difficult to treat, and they try to evade, that's the other thing that's very unique about cancer cells, they evade the immune system. They evade what and they try to hide. They also mutate because they want to survive.
Right.
And so
kind of viruses and microbes.
Exactly.
Bacteria.
Exactly. They change formats, and you have to therefore try to outsmart them. And sometimes you have to change the therapies. You do one for 2 weeks or 6 weeks or 8 weeks, and you have to bring in some other modalities and you have to change them around to try to outsmart them at times. So it's not easy. That's why it's such a difficult condition, but it's such an important concept because the public out there needs it, and really that's what it boils down to.
Yeah. And how do you, any other way you support the mitochondria? It sounds like a lot of different, anything else that you use to support mitochondria?
Yeah. Well, we use lots of things. So first of all, there's, of course, more and more people doing intermittent fasting right now, and that's been shown to maybe be beneficial, as an example. We also, some people will put on a ketogenic diet. There's work by Dr. Tom Seyfried, who's a PhD originally from Boston College. He has shown evidence that ketogenic diets may be beneficial. But by the way, and I happen to lean towards more plant-based type of program for my patients, but you can do a ketogenic plant-based program also. So you can combine the two. It doesn't have to necessarily be one or the other. But yeah, so that does support the mitochondria. There are various nutrients, and of course, I love using the ATP 360, which is a fabulous formulation I've been using for quite a while now, for many, many years, and this has helped greatly reduce the fatigue of my patients. It's been shown to improve the membrane potential of the mitochondria. It also repairs the damaged membranes of the mitochondria and allows for the nutrients that you want to get in and the bad guys to get out. Improves membrane fluidity. And we use nutrients for the mitochondria, things like CoQ10, carnitine, NAD and NADH. There's a variety of things like that, found in the ATP 360 that I think has been fantastic for our patients. Other reparative mechanisms also include, I use a substance called oxaloacetate, which feeds into the Krebs cycle. And what it does, it increases what's called the NAD to NADH ratio. So that's another tool that we use. So there's a lot of different things, that can be done, and also avoiding things that damage the mitochondria. So, for example, so there's so many things today, with our environment, with full of pollutants and toxins and single-use plastic bottles and all the stuff we do. But those things, the chemicals and the metals and the pesticides and the plastics, they all damage the mitochondrial membrane. And so we talk to our patients about changing their lifestyle, changing their diet, changing what they're putting on their bodies for, skincare creams and toiletry products, changing their cleaning agents in their house and using the more what we call environmentally friendly things. It's important because you don't want to breathe all those volatile organic hydrocarbons that may damage. So getting rid of the things that are damaging to the body and bringing in the healthy nutrients that are so important to repair it. You have to repair the immune system and especially the mitochondria. So I do use, a lot of the products, which we could talk about other ones too. But anyhow.
Yeah, well, that's definitely a very comprehensive program for the mitochondria. What about the immune system? When we talked about how the immune system's weak and you obviously do a full evaluation.
Yeah.
I always think of natural killer cells in cancer. That's the primary one I think about.
So that is a very important one. And so I do take a look at all the what's called the T cell, all the lymphocyte subsets, the T cells, the B cells, the natural killer cell activity. And, we see that these things are often suppressed, especially the natural killer cells that you just mentioned. And so it's really important that we support them. So some of the things, I like for that, would include molecular hydrogen, which is the H2 absorb. It's great. I'm going to be using that for years. And when I first learned about molecular hydrogen, which is the H2 absorb, as I said, there's over 1,000 studies been published showing benefits of molecular hydrogen. It's a great anti-inflammatory. It's a great antioxidant. It crosses the blood-brain barrier. It reduces the hydroxyl radical formation. It also it's great for neural inflammation, and it also stimulates what's called the NRF2 pathways to stimulate more even glutathione production in the body and other what's called antioxidant defenses, such as superoxide dismutase and catalase. So it's such a simple product to use too. It's a little tablet. You put in water, it dissolves, and you have your patient drink it down at least once a day is what I use usually, sometimes twice. But what it does, it quenches. Yeah, I usually use that one. I tell them once a day. Yeah, usually once. But what's great about it is the hydroxyl radical, it's OH minus, and that's forming when you have a lot of these free radicals that are forming in the body. And by the way, I forgot now. When you asked me earlier about my lab test, we also run a test for oxidative, it's called DNA and RNA oxidative damage. And we can at least show people, hey, you have too much oxidative damage in your body. Here's what we need to do to repair it. And so one of the products I do use is the H2 absorb. It's great. So it combines H2 with the OH minus, and it turns the hydroxyl radical into water, which is pretty damn good.
Right, yeah.
So anyhow, that's one of the reparative mechanisms that we do. Yeah, it's very simple. And actually, that's been studied for, dozens of clinical, for clinical conditions. And as I said, there's, I think, over 1,000 studies now have been published on the benefits of molecular hydrogen. So I like that one a lot. The other thing I like, and I use a lot, what's that? The neuroinflammation?
Oh, no, I think about it. Yeah, that's what I think of it, because it crosses the blood-brain barrier so easily.
Exactly. And not a lot of things, as you know, are going to cross that blood-brain barrier. So that is one of the things that's quite good. But also I found that, when we have low NK cell activity, we do use the molecular hydrogen. I like intravenous vitamin C is another one, and I do a lot of that. And I also find that the transfer factor multi-immune is very powerful in that regard. Because it also seems to help those natural killer cells. They become stronger. The immune system is able to fight the viruses and cancer more effectively. And the other thing I like about it is it switches what's called the Th2 to the Th1 cells, or balances them out. And with cancer, you usually have a predominance of the Th2 pathways. So we're trying to modulate that. Yeah, and so with the transfer factor product that I use, it's quite effective for supporting the overall immune system. It modulates it, and it stimulates the NK cell activity. So that's another good one that I'd like to use.
Oh, that's
so
great.
There's a lot of things you can do. Mm-hmm.
So then, at one point I was reading about some of your information. You talk about cancer stem cells. Now, are all cancer cells different, and are cancer stem cells even more different, or what's the difference?
Yeah. So in a cancer cell, first of all, another unique thing about cancer cells, cancer itself, is it's very what we call heterogeneous. And not all the cancer lump or bump or the tumor is identical. It's not homogeneous, okay? And so within a tumor, you have various kinds of cells. Some are extremely aggressive, perhaps, as far as the cancer is concerned, but some are perhaps quite benign. And there's different, cytokines floating around, and fibrinogen, and you have a lot of things happening in the tumor milieu. But what did you just ask me? I got off track here.
The
cancer stem cells. So it's within a tumor, you have a percentage of the tumor itself is what's called circulating immune cells. They're also known as circulating tumor cells. But a subset of that cellular milieu is called circulating tumor stem cells. And it's these tumor stem cells that multiply and don't know how to regulate themselves. And these are the ones, there's a lot of troubles with these, but they make up about 1% of a typical tumor, first of all. And secondly, they are generally resistant to standard of care. They're resistant to chemo. They're resistant to radiation. And in fact, that's one of the reasons why you see recurrences. Because when we give someone chemo or radiation, it may suppress the growth of the tumor temporarily, puts the tumor cells into hibernation temporarily, But then sometimes, if you're not careful with lifestyle and diet and meditation, other things we can talk about, sometimes a number of months or a number of years, they come back, and it's like a fire in a forest. It reactivates, and these cancer stem cells now, which were not killed by the initial treatments of chemoradiation, they come back, and they come back with a vengeance, and they're much more aggressive, they're much more hostile, and much more angry now, because they were able to survive. It's like survival of the fittest. So they're able to survive, and they're more aggressive than they were before, and they're also more resistant now to the second course of treatment that the oncologist may elect to use.
Yeah.
So there's a lot of natural things we try to use, and there's even some what's called repurposing of drugs, repurposed pharmaceuticals, which is a whole new area in clinical oncology now, that we're using to quiet and suppress these cancer stem cells. So they're very, very important. And once again, they're a small subset of the cancer initiating or cancer tumor cells. And they're the ones that are most aggressive and most difficult to treat and resistant to traditional therapies.
Yes. And so you said you were starting to talk about how you target these stem cells.
Yeah.
Anything specific you do?
So there are a few things that have been shown to have some beneficial effect. So one is the common drug called metformin. And we all know metformin. It's used, commonly for diabetics. But what they found, it also may have other beneficial effects, not only reducing blood sugar, and therefore you're not feeding the tumor as much, but it also may help suppress some of these cancer stem cells. So that's one thing we use. Then we use a lot of nutraceuticals, including curcumin, which is found in the cytoquel product. So curcumin is one of the things that's been shown to reduce cancer stem cell proliferation. There's also EPA, found in fish oils, and there's something called hinokiol, which is derived from magnolia leaf extract. Boswellia may have a beneficial effect, which is Indian Ayurvedic herb. So there's a lot of different tools that we have in our toolkit that are beneficial. And we often have, resveratrol is a great one too, which is also found in the cytoquel product. So that's another one that I usually use, and it helps reduce the pain, the inflammatory markers. It also helps reduce the clotting factors so it may help reduce fibrinogen, maybe that D-dimer. So so we use a lot of cytoquel. Usually people using 3 to 4 a day. And it's a great product because it's a good combination of things and also has some I think black tea or green tea and some tocotrienols in there. And by the way, tocotrienols is another thing that most people never heard of, but it's a cousin of like vitamin E, and it's the delta and gamma fractions of that have also been shown to perhaps slow down those cancer stem cells and also have an anti-tumor effect in many cancers directly. There was a couple studies, I think, on like pancreatic cancer where it showed benefit just using some of the tocotrienol products. So there's a lot of exciting things going on right now in this field.
Right. It sounds like a lot of things you mentioned are what I think about for inflammation. So do you think they're helping because they're targeting inflammation? Is that part of it?
Absolutely. Yes. I mean, very much so. And in fact, the cytoquel has been shown to downregulate the inflammatory cytokines. And so, these are all especially the pro-inflammatory ones like the IL-1, IL-6, IL-8. These, can, especially 6 and 8, I should say, they're very pro-inflammatory. And, so we use a lot of different products. First of all, we check these cytokines. And then secondly, we use products that we hope will target these inflammatory pathways. Because you really do have to downregulate inflammation if you're going to effectively help your cancer patients. And so we do it, this is the way we do it biologically and biochemically and metabolically. The patient has to do and play their role to, eat an anti-inflammatory based diet and work with other modalities, including stress reduction, meditation, prayer, and those things, which also, believe it or not, will help downregulate the inflammatory pathways as well.
Yes, that's definitely integrative medicine, right? Kind of targeting all of these.
Yeah. Exactly. You have to use, every modality. Go ahead.
Right. Oh, no, I was thinking like when I think about inflammation, I also think about oxidative stress. And then you talk about all the mitochondria damage, and I always think of how oxidative stress damages the mitochondria. So do you kind of look at oxidative stress? Is that a big issue in cancer?
Yes, we do. We absolutely do. It's a very big, because it's the oxidative stress that leads to these reactive oxygen species, which then damage the mitochondria. And so everything we talked about, most everything we talked about so far, all can reduce the oxidative stress to the cells. So, and another thing that I like to do is using glutathione. But I will say that's a little bit tricky sometimes, because if a patient is getting IV vitamin C in my office, I tell them to hold off on the glutathione during the time that they're getting C intravenously, because there's some controversy that it might not be wise, because vitamin C, when you give it IV, is a it's not an antioxidant. It's actually a pro-oxidant. But when you give glutathione, especially we use the liposomal form here, the Trifortify orange or watermelon, that is an antioxidant. So I don't recommend giving the two concurrently, but I do believe, and I do use, the glutathione quite a bit, but just on different days when they're not getting the IV vitamin C. And another blood test we do is I do check glutathione levels. We do check reduced glutathione, and we do see a lot of people are really low in it. So this is another biomarker that we can easily follow and see, is our course of treatment truly, helping the patient, at least metabolically? And if it's helping metabolically, chances are it's going to help clinically as well. So it's an exciting, thing. But so when you have the oxidative stress, which we do in cancer cases, you have to support those mitochondria, because that stress and the reactive oxygen species is going to damage the mitochondrial membranes. So that's where even like the ATP 360 and the H2 absorb and the cytoquel, the transfer factor, all those things are so important to try to repair the damage to the tissues and to the mitochondria and to the membranes.
Right. I mean, I think about chronic diseases. A lot of chronic diseases have the same kind of pathology, mitochondrial dysfunction, inflammation, oxidative stress. So, I mean, do some of the therapies that are you using, can you kind of take this to other illnesses in terms of treatment or diagnosis?
No, sure, absolutely, you can, because they all have a similar foundation of etiology. And, as we said earlier, most chronic diseases that we see all have at the base level of excessive chronic inflammation. And it's that inflammation that leads to reactive oxygen species and leads to oxidative stress, and therefore leads to mitochondrial damage that causes the cells not to be able to repair themselves. And if cells can't repair themselves, this leads to chronic illness. And that's part of the problem with cancer, but not only cancer. I mean, you could name heart disease and high blood pressure and obesity and depression and autoimmune diseases. All these diseases have a similar root cause. And, the ones we just talked about were at the cellular level, but they're all, can be induced by the environment and foods and stressors and lack of exercise and too much alcohol and all the things that people do, unfortunately, that causes ill health.
Right. I mean, as I said, I'm in the pediatrician. I'm in the world of autism, and all of these things, it's the same idea. All these kids have mitochondrial dysfunction, inflammation, excessive stress, chronic infection. A lot of the same things. And I wonder if we'll see more cancer in these kids at some point. You think about they already have some pathology.
I hope not.
I know. I hope not. So
but,
it's kind of scary.
No, but you bring up a good point, because I've seen 3 kids in the last year who all have glioblastoma multiforme, brain tumors.
Yeah.
And I never saw that in my practice before. And, I normally don't treat kids because I'm not a pediatrician, and it's just not what I want to do, especially if they have cancer, for medical legal reasons especially too. But that's besides the point. But I'm just saying, I never saw kids before who had cancers, and now they're trickling in here. And as I said earlier, we're seeing more cancers at earlier ages, and of course autism. I mean, it's certainly on the rise. It's 1 out of 50, whatever it is right now, which is frightening. But you're right; they all have a similar root cause. And I think we've altered our environment. I think we've altered our food supply too much, to the point where the body can no longer adapt and hasn't adapted to this drastic change in the last 30, 40, 50 years, that we've seen it now. And we really have to get back to basics. That's how I look at things. And it's going to take a while.
Even people who don't have cancer is to, look at some of these things, even preventing cancer, just like preventing autism, trying to get people before they're sick.
Absolutely. And I do a lot of that,
Yeah, you do a lot. Yeah, I think a lot of integrative doctors do.
Absolutely. You have to, because, let's face it, the best treatment is going to be prevention.
Right.
So.
Yeah. I'm sure you get people who've already been treated multiple times, and it's like, you kind of wish you got them earlier. But, So let me just ask you, are there any other insights in treating patients with cancer? Because we do want to kind of get to some questions.
Okay.
Any other pearls for patients, for practitioners, or?
Well, I think we should need to start as early as we can. We need to change what's in our refrigerator and what we're eating each day, and really think about what we're doing with our life. I always ask my patients to, before you eat, say to yourself, is this going to be health enhancing or health inhibiting? And even though the patient may not always make a change, even though they may not make a change, they'll at least think about it once or twice before they make their final decision. So, so that's one thing I do is, always ask, is this going to be health enhancing or health inhibiting? If they answer health inhibiting, they may not eat it as often. They may eat less of it. They may not eat it at all. Who knows? So that's one thing. And then, I think getting involved at an earlier age too of exercise is certainly important. It stimulates the healthy, what's called stem cells, and it helps the mitochondria function better. So regular exercise, I tell people at least 150 minutes a week of moderate exercise if they can. So it's like 30 minutes, five times a week. And also getting involved in some kind of mind-body kind of work too, because 90% of the patients that walk in my door with cancer, they tell you they had some type of significant stressor in the preceding years. It could be 2 years, 5 years, who knows. But the point is, the stressors that people, a horrible divorce, someone lost their job, something, an untoward event has been associated with close to 90% at some point of the cancer that we see in the office. So I talk to patients about, getting rid of the anger and frustration and resentment and bring in, happiness, hope, and laughter. And if there's toxic people around you, you will know people that they're sort of toxic and they drag us down. Keep them out of your lives a little bit. You got to take care of yourself, and no one else can do it as good as well as you can, in a sense. So, I think that, those are some of the pearls that I give to my patients. And I talk about prevention most often. I say, eat a colorful plate and bring in different nutrients from all different kind of foods. Don't be and try new things. Don't be afraid to try new foods, and don't eat the same 20 foods your whole life. Bring in 50 different foods throughout the week.
Right.
I
talk about my kids eating a rainbow.
Yes,
That's how I talk
of course.
About it. Yeah, like the classic one.
Yep.
Yeah, so some really kind of basics for all of us, really, in terms of health and exercise and everything else.
Exactly. This is for all diseases, as you said, and if we all thought in these ways and actually practice what we preach, because we kind of know this stuff, but most of the time that Americans, including physicians, don't practice as well as what we preach, of course.
Right.
But anyhow, if we did that, I think we'd be a healthier society, and we wouldn't have to just rely on the pharmaceutical world to, cure it doesn't cure, to treat every single ailment. And then we have to use natural agents, which are far safer, and far less side effects, and I think very, very efficient and effective. So
that's great.
And the other thing about that's beautiful, I think, about some of the natural agents too, like curcumin. I'll give you an example of that. But it can target so many different pathways in the cancer cell cycle and the cancer proliferation pathways, whereas most drugs only go after one pathway. Something like curcumin and something like even resveratrol have multiple modes of action as far as their beneficial effects, and they can work in so many different mechanisms of action, which is nice. And so that's why I also like to use natural agents most of the time as my first choices. And I have patients that do go through conventional therapy but use me as well. And then I have also patients who totally they refuse conventional therapies and they use me as well. So we can support them while trying to build up their immune system and give them the best quality of life possible.
Yeah, that's great. I mean, I kind of feel like some of the things you mentioned, I think curcumin doesn't help everybody because we're all exposed to so much. We have inflammation, so it doesn't make sense for some of us to take some of these herbs and some of the supportive stuff all the time anyway.
Correct.
So
Correct. Exactly. And I think almost every adult could do well to take some extra curcumin, each day, and resveratrol. And there's no real downside. There's no downside really. Not going to harm you.
Right. And I like to think of like herbs as kind of synergistic too, so combinations there. Let's go on to some questions. And again, it looks like some of these are pretty specific. So I'll just read what I have, and then we'll go from there. So first question, it sounds like there's some very specifics about some patients too. But this first one is, my client has stage 4 cholangiocarcinoma, and he sounds like one of his doctors won't let him take a Crypto Plus because of black walnut hull. And I guess the question is, what protocol would you use based on this diagnosis and these products? Does that make sense?
Okay. Yes and no. So I explain to my patients, I'm not treating the name of the disease. So let's say they have stage 4 cholangiocarcinoma. The problem is not all cholangiocarcinomas or breast cancers or prostate cancers, whatever cancer you want to name, is triggered by the same etiology. They are not. And so to treat everybody the same way, to me, is not sensical, nor is it what I do. And what I'm saying here is if we treat everybody with a personalized approach and a targeted approach, you're going to get a whole lot better results. So my point is that, if we find somebody has very high levels of this thing called galectin-3 I mentioned briefly, that person is going to be treated maybe differently than someone whose levels are completely normal, but yet there's other, high levels of inflammatory cytokines perhaps floating around. So what I'm getting at is, because even people with the same diagnosis of, let's say, breast cancer, the cause of that can be different from one person to another. And one of the problems, I believe, in conventional treatments is they treat everybody the same, as if, breast cancer is breast cancer. Well, it's not. The mutations that have occurred and the biochemistry and metabolism in that person could be completely different. So anyhow, to get to this person's question, there's no way I can tell how to treat any one individual just by, here's my diagnosis. But, once again, it's all about strengthening the immune system and reducing the key factors that cause the demise to the patient. And so once again, there's 5, I tell patients, there's 5 major causes of death to cancer, unfortunately. And it's metastasis. So we try to protect them from that. And that means, protecting against those stem cells that we talked about, the cancer stem cells. We try to protect against blood clots, cachexia, end organ failure, and infections. And if we can protect the patient from those 5 things, that patient frequently can do quite well. So, we have to use a different mindset and not just think, all right, here's breast cancer, colon cancer, liver cancer. How do you treat that? Now, there are obviously some studies that we do work with that helps to, might say, hey, curcumin is particularly good for liver cancer, let's say, or pancreatic cancer. Sure, I would absolutely use those examples, and we would target with those agents. And that's where, the cytoquil and the multifactor immune may be great factors for those kinds of things. But it really depends, and I think you have to look at each person individually, and it's very hard to give a blanket statement for all cancers.
Right. Because I think that's with all medicine. The next question asked about metastatic prostate cancer. Now, would you do the same thing? Like, what about like a cancer that hasn't spread versus metastasized? Do you target those?
Well, if perhaps we may use, some hormone blockers if we have to, but I'm not big on those. But sometimes the pharmaceutical ones. But sometimes I use some botanicals for that purpose as well. So we do sometimes treat those differently. And without getting too specific, this whole concept of repurposing of drugs, we do use some pharmaceuticals that sometimes case by case basis that may help to reduce the spread of cancers. And, if someone has, it really depends. But I'll just throw out, I mentioned metformin. There's also studies showing that combining vitamin C with doxycycline, which is an antibiotic, may also help reduce tumor spread in general. There's other studies showing that a antiparasitic agent called mebendazole may also be appropriate in various cases. And you can Google this and you'll see studies that come up with all these things. And there's a couple books been written now about starving cancer. There's one, and there's another book by Travis Christopherson about using these what's called repurposing of drugs. It's basically medications have been used for other conventional reasons, but now using them against tumors, which they found may be beneficial. A simple one you can think about is aspirin. We know that aspirin might help reduce colon cancer, for example. Now, obviously, the side effects from every drug that I just mentioned. So I'm not big on these things because I happen to be a fairly natural doctor, and I'm not, excited to use pharmaceutical agents. But I do occasionally use them. Yeah. But we do everything possible to protect the patient against possible side effects from these things.
Okay. Well, the next question asks just about something different. Asked, what mitochondrial test do you do?
So The best one is probably something that I don't do, unfortunately, because I don't have the machine for it. But many of our listeners have heard of Dr. Frank Schallenberger from Nevada. And Frank and other doctors have used this. It's a special test measuring the oxygen consumption, putting a patient on like a treadmill, and you're measuring the oxygen flow and oxygen utilization in the body. I don't have that technology in my office, and it's a very good way of assessing mitochondrial function, by the way. Let's say it's about $15,000 or so, and I don't have it. So I just, I have some toys in my office, but at some point you stop buying the toys because you can't afford them anymore. But anyhow, So no, I do a blood test. It includes levels of lactic acid, pyruvate, coenzyme Q10, which I didn't mention yet, but maybe I'll throw something about that in a minute. Carnitine, and I think there's one other part of my mitochondrial panel. So those are, biochemical blood tests that give us some idea. But I'm going to tell you right now, it's not perfect because a lot of times these tests, the blood tests, can come back fairly normal. And I know that when when patients have had this other, it's called bioenergy test that Dr. Schallenberger does and others do, you do see more abnormalities on that test. I think it's much more sensitive, it's much more specific, and I think it's truly more accurate. But for the poor man's way of doing it, which is what I do, I send it out to one of the reference labs, and we do a battery. I think it's 5 different things that are included in the metabolic panel for the mitochondria. And I mentioned CoQ10 for a moment, and that's a key nutrient, especially for the mitochondria. It helps us, to make more ATP within the mitochondria, helps with electron transport. And I've been using that for years for my cancer patients, but also my heart patients, of course, as well.
Right.
And just for overall cellular energy. I think it's a great substance, and it's well absorbed. The CoQ10 Power is a fabulous product. It's also high dose. It's at 400 milligrams. I like that because many, many years ago, I was using like 100 to 200 milligrams, and I didn't see my CoQ10 levels going up as much because I do measure them. So now that I'm using the 400s, I do see that the levels are rising quicker and staying up more appropriately. And by the way, I do some blood tests for that, as I said, and I like to optimize that because the normal range for the lab that I send it to is above like 0.45, I think. But I like to see it between 1 and sometimes higher than 1, and sometimes up to 2.
Okay.
I don't know what the units are, to be honest with you. So anyhow, it's another tool that we use to try to optimize a patient's biochemistry.
And then for that, do you use 400 milligrams, or do you ever use higher doses with your patients, depending on the level?
I usually start off, So I usually start off with 400. And if I don't see any response after about 4 to 6 weeks, I might go up to 800. And especially the people with some of the, significant cancers or some of my neurodegenerative diseases, the Parkinson's, the Alzheimer's, ALS. I'll go sometimes 800 and sometimes even up to 1200, but not too frequently, but I still do it sometimes.
Sometimes, okay. Because one of the things I learned in the autism world is to look at some of the organic acid metabolites for mitochondrial markers.
Right.
I don't know if you...
Correct. I forgot about that one. I do use that. Yeah, thanks. Okay. Thank you. Okay. I do use that, and we look at all those markers, and that's very useful as well. I forgot about that. It's a urine test, so it's easy. Yeah, it's easy because it's urine, and the kids don't mind doing that. Right. I don't see the kids with cancer, but too much. But I'm just saying in general, we do combine that with the blood test as well. Mm-hmm.
Right. Well, the next question is about how do you treat a high D dimer? I know that obviously cancer is a hypercoagulable state.
Yeah, so I think there's a couple things there's a couple things I use. One is it's called nattokinase, which is it's actually a seaweed product, commonly grown in, I think, off of Japan. But I'm just saying it's commercially available as a supplement, and it's actually a food. When I was in Japan lecturing a number of years ago, they actually used it as a food, and they fed it to me. And it was terrible tasting, by the way. So I like it in capsule form. So that's one thing. And the other thing we use a lot of times is lumbrokinase. So that's commercially available as well. So that's another enzyme. So different enzymes is the answer, may be beneficial, and we do track it. We do track the D-dimer levels. So we can see a response, a clinical response.
And what about nattokinase versus lumbrokinase? Is one more specific, or is there one reason you'd use one versus the other?
I haven't figured that out yet. So I start with one. I'm being honest with you and sincere here. So I start with one. And if I don't see a biochemical response or metabolic response, I will frequently switch to the other. Also, I will tell you, if someone's levels, like normal level for the D-dimer is below 0.45, but if someone's like above 1.5, which I do see sometimes, I actually may use both of them at times because I think you need to hit it from various areas, and I think they have different properties. But I usually, if it's below that, I just start off with one, and if I don't see response, I may transition and try another because everybody responds differently to different substances and different nutrients and different foods. So, sometimes it is a little bit trial and error.
Yeah, I know that's definitely integrative medicine.
I mean, that's the beauty of the art of medicine a little bit too. It's not it's not a black and white field.
It's an art, and it's very personalized. And I'm thinking
yes,
you really have to look at all the different factors you talked about in terms of labs and where they are and all that stuff. So here's a question that asked about there's a concern. Is there a concern about CoQ10 stimulating tumor growth?
No, I don't think so at all. No, I don't think clinically that's ever been shown to truly occur in any kind of documented studies. I don't see why that would happen really. It's a very safe molecule, and it's both water and fat soluble, and that's why it's good. It can also cross blood-brain barrier, and that's why it's good for neurodegenerative diseases sometimes too. But no, it's a very safe substance overall. There's been a lot of research on it, and by the way, if any of the patients happen to be on a statin drug, which some are for their cholesterol, which I'm not a big fan of also, that drug will deplete some of the CoQ10 from the body, and therefore the cellular energy will be depleted as well. So you have to be, in particular, if patients on a statin drug, and there's other drugs, by the way, that also disrupt normal mitochondrial function, which it's a whole other field. But anyhow, so we do use CoQ10 in those patients, and especially if they have the muscle pains and aches and pains and the fatigue. So many cancer patients are tired. Yeah, so you got to do something to improve their clinical condition and bring up their energy. Nobody wants to feel fatigued all day.
That's quality of life. I mean, and then not being able to exercise, anything else. I think we probably have enough time for one more question. And it's asks about metformin. And is it clear whether the effect of metformin is from its lowering blood sugar, or is there some other mechanism of how it's working?
Well, I think it's both. And I think that number one, we do know it lowers blood sugar, but there's also some studies showing that it also inhibits these cancer stem cells from proliferating. So by other mechanisms of action. Yeah. Okay. Now, I will say a word of caution. Word of caution is about 4 to 6 or so weeks ago, there's a report on the internet that some of the metformin might be tainted with a possible cancer-forming contaminant or substance. So that's another problem, which I don't think they've reported yet what's really going on. So honestly, over the last 4 to 6 weeks since I read this, and you can just Google, you'll find that, I have slowed down my prescribing. I've reduced my prescribing of it a little bit until we find out more information and make sure that it is it's safer than what it's safer than what we think, or it doesn't have a cancer-causing. I forget the name of the substance, but they said there's a substance in there, and I don't know if it's coming from overseas. I don't really know because they haven't reported much on it yet. But that's the problem. Some of these things are produced in factories that don't have good quality controls and don't have the quality control in their machinery or their sources, the raw ingredients that we really need them to have. So that's a whole nother area. And these things are not perfect, and we have to be cautious. So that's
when I think about just compounding something, just taking the absolute medicine and just making sure you don't have anything else in it. That's what I do with some things if I'm concerned about the kids. So, so we are at time.
Absolutely.
And I said people can, send an email to me at dhamilton@researchnutritionals.com. And I said I can be in touch with Dr. Magaziner. And I want to thank you so much for taking the time to answer the questions and go through this, your comprehensive program. It makes a lot of sense, and I think a lot of people are going to, benefit from this information. So appreciate you taking the time.
Well, it's my pleasure, and I hope that everyone has learned a little bit from this, and that our patients therefore can do much better overall.
Okay. Well, thank you very much. All right.
All right. Have a great day. Have a good day.
You too.
Bye-bye.
Okay. Bye-bye.
Bye-bye.